Renal Diet Plan and Cookbook for Kidney Disease and Health, written by Shelby Anderson. Narrated by Mark Booker. Renal Diet Plan and Cookbook for Kidney Disease and Health, by Shelby Anderson. Narrated by Mark Booker. Introduction. When you have chronic kidney disease, diet is an important part of your treatment plan. Your recommended diet may change over time if your kidney disease gets worse. Not everyone has the same restrictions, and everyone's diet is individualized. Nutrients affecting the kidney are protein, sodium, potassium, and phosphorus. Protein. Eating the right amount of protein will help to build muscles and repair tissues, fight infections, and prevent wastes from building up in your blood. Large protein portions may increase the workload of the kidney. Keep portion size to 3 ounces per serving. Protein comes from red meats, poultry, chicken, turkey, duck, fish and other seafood, eggs, milk, cheeses, tofu, legumes, and beans. Tip: there are 2 kinds of protein. Higher quality protein comes from animal products like meat, poultry, fish, eggs, and dairy products. These are the easiest proteins for your body to use. Lower quality protein comes from vegetables and grains. A well-balanced diet should include both kinds of proteins every day. Sodium. Limiting sodium, a mineral found in most foods, to 2,000 to 3,000 milligrams per day helps to reduce fluid buildup in the body and to control blood pressure within normal ranges. Sodium is found in most foods, but is especially high in table salt and sea salt, salty seasonings, example, soy sauce, teriyaki sauce, garlic salt, and seasoning salt. Tip: eat foods closest to their natural state, unprocessed. Read food labels for sodium content. Try fresh or dried herbs and spices instead of table salt. Avoid salt substitutes. Potassium is an important mineral that helps your muscles and heart work well. Too much or too little potassium in the blood can be dangerous. Not everyone needs the same amount of potassium. How much you need will depend on how well the kidneys are working, if you are taking medication that can change the level. Potassium is found in all foods, but large amounts are found in certain fruits and vegetables, bananas, melons, oranges, potatoes, tomatoes, dried fruits, dark green leafy vegetables, and some fruit and vegetable juices, milk and yogurt, dried beans and peas, salt substitutes, chocolate, nuts and seeds, lentils and legumes. Tip: know your blood potassium level, normal 3.5 to 5.0. If it is too low, you may need a supplement to raise the level. If it is too high, you will need to avoid high potassium foods. Phosphorus is a mineral that works together with calcium to form strong bones and teeth. In kidney disease, phosphorus starts to build up in your blood, and calcium is pulled from the bone into the blood, causing serious problems like damage to the heart and other organs, poor blood circulation, bone pain and bone weakness, skin ulcers. Phosphorus is found in most foods. Large amounts are found in dairy products, milk, cheese, pudding, yogurt, ice cream, dried beans and peas, kidney beans, split peas, lentils, nuts and seeds, other beverages, colas, beer, cocoa. Tip: use non-dairy creamers and recommended milk substitutes in place of milk to help lower the amount of phosphorus in your diet. Renal disease. The kidney is a vital organ. It not only removes the waste products from the body in the form of urine, but performs many other functions as well. The kidneys have plenty of spare capacity, yet they can be damaged to the extent that their replacement in the form of either dialysis or transplantation becomes essential. Kidney diseases affect everyone, right from children to the old people. Unfortunately, our knowledge and technology has advanced considerably, and now it is possible to cure people of many a disease of the kidney which used to be fatal. It is also now possible to salvage a kidney from a very hopeless situation, and even in the event of total failure, we can keep the person alive for many years. It is unfortunate that there are not very many symptoms in early stages of kidney diseases, and this is perhaps the cause for the delay in the institution of the treatment. Most of the chronic problem of the kidney are insidious and take a long time before they exhibit frank symptoms. Therefore, it is essential that people should know the early symptoms and act promptly to save the kidneys. Normal considerations. Kidneys are paired organs situated in the back of either side of the vertebral column, just underneath the lower ribs. They are bean-shaped organs and each weigh about 150 grams. There are minute tubular units in the kidney which filter urea, creatinine, and the other waste products from the body round the clock. In 24 hours, approximately 200 liters of fluid are filtered in the kidneys, but only 1.5 liters of urine is discharged out of the body. The rest is absorbed back into the blood. The kidneys are connected to the urinary bladder by 2 tubes known as ureters, where the urine is stored. From here, it is periodically urinated through another tube called the urethra. Besides producing urine, the kidneys help in controlling the blood pressure, and they also help in production of red blood cells. It activates natural vitamin D into its active form. Usually, one kidney is enough to maintain life properly, and it is only when more than 95% of the kidney tissue is damaged that the patient needs assistance with dialysis or transplantation for survival. The main diseases. There can be defects in the kidneys during the development in the mother's womb. They are called congenital defects like polycystic kidneys. The commonest affections of the kidneys are infections. These infections could be acute or they could be slow and chronic. Acute infection like pyelonephritis, pyelonephritis, etc. are quite common. Chronic infections include chronic clonefritis, tuberculosis, nephritic syndrome, etc. Diabetes and high blood pressure damage the kidney in the long run. As a matter of fact, a damaged kidney does cause high blood pressure. Tumors of the kidney are also quite common. Besides cancer, there should benign tumors also that can arise in the kidneys. At times, allergic reactions to drugs and other chemicals may cause kidney damage. Stones are also well known for causing kidney damage. All these common diseases of the kidney slowly destroy the kidney tissues and finally result in kidney failure called uremia. This is the time when extra help is required to survive. Common symptoms. Out of the few symptoms that manifest themselves when a significant amount of kidney functions are impaired, more than 75%, the main signs and symptoms are related to urine. There may be increased frequency of maturation with burning, as in the case of infection. Pain may or may not be there. Stones may be silent or may cause pain, depending on the site of the stones. If it is in the kidney, the pain is usually located in the back of the affected side. This is usually colicky in nature, and it may travel in front. A stone in the ureter causes pain in the flank, which may travel down towards the testicles or thigh. A stone in the bladder may cause pain in the lowermost part of the abdomen. In chronic infections, the pain is not usually severe, and it may be a dull ache. In some cases of stones, tuberculosis, and tumors, the patient may pass blood in the urine called hematuria. This may be a prominent symptom in the bladder problem. Besides, there are generalized symptoms which are vaguer and cannot be specifically attributed to kidney diseases, but they, in correlation with other specific kidney symptoms, may help in reaching a diagnosis. Excessive fatigue, anemia, impaired appetite, vomiting, tiredness, difficulty in breathing, particularly on excretion, ankle swelling, etc., are few of the symptoms. In nephritic syndrome, puffiness of the face is quite characteristic. Hematuria may be painless, and in such events people ignore it because it is pain that usually compels them to seek medical advice. Blood in the urine may signify infection and stones, but without pain, it may indicate serious disease like cancer and tuberculosis. Therefore, it may be very dangerous to ignore blood in the urine. It should be investigated immediately. Kidney infections. Kidneys can be infected in the conventional way by a variety of germs which may reach them either by the blood or the germs may ascend up the urinary tract to the kidneys. These infections could be acute if the organisms have the upper hand or the defense is low. It also depends on the type of organism that affects the kidneys. Infections like tuberculosis develop slowly and run a chronic course. Obstructions play a major role in the causation and development of infection. It is a well-known fact that even stagnant water gets dirty. Likewise, any slackening or stoppage in the flow of urine will obviously encourage infection, and this is why stones and infections are complementary to each other. Besides the conventional method, there is another way of kidney damage. The body defense system, under uncommon circumstances, start destroying the kidney tissues, resulting in autoimmune disease of the kidneys. Glomerulonephritis is an example of such process. The net result of all these processes is kidney destruction and finally kidney failure. Besides the kidney, the bladder is the next common site of infection. Infection in the bladder is called cystitis. This could be acute or chronic. Stones and infections. We live in a hot climate, and here, if we do not drink enough water, we produce concentrated urine. If obstruction is added to these already concentrated urines, stones precipitate rapidly. In about 5% of the patients, stones can result from diseases of other organs of the body, like parathyroid tumor or gout. In the rest of the 95% of the patients, there is no definite cause, but this combination of infection, obstructions, and other factors work. Because of the stones lodging at the narrow outlet of the kidney, pelvureteric junction, the flow of the urine is back pressure and damage to the renal tissues. In the initial stages, the kidneys try to push the stones down, thus explaining the pain. The cessation of pain may indicate an exhausted kidney, therefore it should not lure the patient into a false sense of security. As long as pain exists, one can assume, in most of the cases, that the kidney is functioning. Management of infections and stones. Before giving antibiotics for infections, it is essential that we know the types of organisms and their sensitivity. For this, urine examination and culture and sensitivity should be done. To know the working of the kidneys and the damage already caused there, intravenous picogram and estimation of blood urea are helpful. Proper antibiotics, given in proper doses, under medical supervision, for an adequate length of time, control the infections. During the therapy, the patient is encouraged to take plenty of liquids. If one kidney is totally damaged and there is no function in it while the other kidney is normal, the useless kidney can easily be removed. The fear that life will be miserable after removal of a kidney is baseless. One can easily survive normally on one kidney. For stones, the only available method at present is surgery. If the stone is very small and can negotiate the narrow urinary passage, then we can wait and expect it to be passed out. However, if it is causing damage, it should be removed immediately. In case of multiple stones lodged in one part of the kidney, that half can be removed by surgery called partial nephrectomy. There may be claims that there is a known solution that will dissolve stones and would leave the normal tissues intact. Those who claim such miracles only deceive people, and people should not fall prey to such quacks. High blood pressure and diabetes. High blood pressure and kidney disease are interrelated. Persistent high blood pressure can cause irreversible kidney damage. At the same time, if the kidneys are diseased and their blood supply is restricted, then such ischemic kidneys can cause high blood pressure. This is known as renal hypertension. Many of these cases of renal hypertension are amenable to surgery. Diabetes, over a period of years, when not managed properly, can cause kidney damage, and this again is permanent damage. Therefore, diabetes should always be treated properly. Tumors of the kidney. Painless hematuria, blood in the urine, abdominal tumor, or kidney failure can be the symptoms of tumor. It is unfortunate that cancer of the kidneys grows slowly and silently, and valuable time is lost before the patient reaches for medical help. It is here that the importance of regular checkups can be emphasized, as during these checkups we can diagnose such serious ailments in the early stages. The treatment is only removal of that kidney. If it is diagnosed in the early stages, then the operation is easy and patient can survive for many years. All these diseases, if left unattended, finally culminate in kidney failure called uracemia. The patient can still survive, provided the waste products of the day-to-day body activities can be removed from the blood. These people used to die, but now they can live for years on an artificial kidney. The other method of substitution kidney is to transplant them, i.e., a donor kidney, in the patient's body. Something about dialysis. With the advancement of sophisticated machines, the patient's blood is purified by passing it on one side of cellophane membrane. On the other side of a solution is passed. This solution is constituted in such a way that it attracts the impurities by process of osmosis, and the waste products pass through the membrane from the blood into the solution. The purified blood is then returned into the patient's body. This has to be done at least 3 times a week, and each time it takes about 6 to 8 hours. Another method of purifying the blood is by passing a solution into the peritoneal cavity, abdomen, and leaving it there for some time so that the impurities can pass into this solution. This is then removed. It is not as effective as blood dialysis, and there are chances of complications. This is a method that does not require an elaborate apparatus and can be done at any hospital. Kidney transplant. The replacement of diseased, worn out, or injured tissues and organs with sound parts has stimulated the imagination of Maine for many centuries, and kidney transplantation is a sequel of such thoughts. Among the major organs, kidney transplantation is the most successful and is most commonly done. This is perhaps because the patient can be maintained on dialysis prior to the surgery, and the technique of transplantation is not very difficult. The important aspect of this organ transplant is that a healthy human can donate one kidney without suffering from any damage or serious consequences. The main obstacle to successful implantation of tissues from one person to another is the rejection phenomenon. Our body normally refuses to accept any foreign tissue, and it fights its entry. Slowly and gradually with research, we are overcoming this problem, but it still poses a big threat. Rejection is less severe and less frequent if the transplanted kidney matches closely with the patient's tissues, for example, kidney from blood relatives. In such cases, the success rate is very high. Before the transplantation is done, the tissues of the donor and the recipient are matched, and then only the kidney is accepted for transplantation. Therefore, it is obvious that blood relatives who are in absolutely good health should donate a kidney to the ailing relative. We always make sure that the donor's health is not jeopardized in any way. No doubt the donor has to undergo a major surgical procedure when their kidney is removed, but it is worth when somebody's life is at stake. Once the kidney transplant is accepted, the quality of life for the patient improves dramatically, and they resume their normal lifestyle. Nature has given plenty of reserve in our kidney. It is mainly through our ignorance and negligence that we push ourselves to the brink of kidney failure. Most of the kidney diseases are now manageable, and even after kidney failure, there is hope in the form of dialysis and types of renal diseases. Our kidneys are an amazing creation. They are more complex than we can imagine and keep functioning with very little regard from us until something goes wrong. The two small organs are located in the lower back on each side of the spine. Their main purpose is to filter the blood and control the levels of potassium, salts, and acids. The filtering structures are small clusters of blood vessels called glomeruli. When they are working properly, they allow the excretion of waste materials into the urine while retaining water to keep you from dehydrating. There are different types of kidney disease that will hinder the work of the kidneys. When the kidneys become diseased, excess fluids and waste materials begin to build up in your body. Blood pressure will often elevate, and you will notice swelling and other warning signs to alert you that something is wrong. Here is a list of the major types of kidney diseases that we know. Hereditary disorders. Hereditary kidney disorders usually produce clinical symptoms in both males and females in a person's teen and young adult life. Polycystic kidney disease is the most common hereditary kidney disorder. Primary hyperoxaluria, Alport syndrome, and hereditary nephritis are other hereditary kidney diseases. Congenital disease. Genitourinary tract malformation causes congenital disease. This disease often creates obstructions in the kidneys that cause infection and destruction of tissues in the kidneys. As it progresses, congenital disease will lead to chronic kidney failure. Kidney stones. If you have kidney stones, there may be the sudden appearance of sharp stabbing pain that comes on in waves and then goes away just as rapidly after you pass the stones. Kidney stones is the formation of sharp, hard crystals in the kidneys and urinary tract. The pain comes from the sharp edges of the stones, cutting the walls of your kidneys and urinary tract. On occasion, a large stone can block the urinary tract and require surgery to remove it. Nephrotic syndrome. This disease causes your body to lose large amounts of protein in your urine. High blood cholesterol, low blood protein, excessive fluid retention, and edema are all signs of nephrotic syndrome. Diabetics are usually the ones that suffer the most with nephrotic syndrome. Kidney cancer. Renal cell carcinoma is listed as the most common kind of kidney cancer by the National Cancer Institute. When kidney cells begin to grow at an abnormal rate and fail to die off as they should, then kidney cancer develops. Renal cell carcinoma starts in the cells that form the tubules of the kidneys. Transitional cell carcinoma starts in the cells of the renal pelvis. If you have high blood pressure, are obese, and a smoker, you increase your risk of kidney cancer. Lupus nephritis. Lupus nephritis is a kidney inflammation caused by systemic lupus erythematosus. This is an autoimmune disease. The autoimmune system will sometimes produce antibodies that bind to proteins in the blood, then get trapped in the kidneys and cause inflammation that causes kidney damage. If you notice dark, foamy urine, experience weight gain, and have high blood pressure, ask your healthcare professional about lupus nephritis. You may also be able to treat some of these kidney diseases, and others may progress and cause severe kidney failure. If your kidney disease has advanced this far, you may need dialysis, or your doctor may talk with you about a kidney transplant. There are some natural medications and plans that have been used successfully to reverse kidney disease if it is not life-threatening. How to avoid renal disease. The first and foremost advice of avoiding any kind of kidney disease is to quit smoking. It is a well-known fact that smoking is seriously injurious to health, and due to smoking, the probability of developing serious health conditions increases. An effect of smoking is that it narrows the arteries and the small filtering units present inside the kidney, which affects their performance and hence the performance of the kidneys as well. The kidney loses its ability to function properly. Smoking, besides creating problems in the functions of a kidney, is also found to be a base leading to cancer of the kidneys, ureter, which are the tiny tubes that connect the kidney and the bladder, and the cancer of bladder itself. It is heavily advised to quit smoking as it is very essential for the proper functioning of the kidneys. Also, your alcohol intake should be monitored if you are suffering from a kidney disease. Studies indicate that alcohol may pose no threat to your healthy kidneys. However, if you are suffering from a kidney disease, excessive alcohol consumption may further worsen the situation. Alcohol is responsible for making the kidney develop or produce more urine than usual, and in case of excessive drinking, a negative impact may be imposed on other organs of the body that may later on contribute to the kidney disease. An example is the liver that is most affected through excessive alcohol consumption, which contributes to kidney diseases at later stages. Also, studies point out that alcohol contributes to several heart diseases and increased blood pressure conditions, which through time affect on your kidneys as well. Also, since alcohol is sugar-rich, it leads to increased weight, which is still another kidney damage contributor. Reversing kidney disease. When you change to a high-protein diet and sacrifice carbohydrates to build muscle mass, it will definitely take its toll on your kidneys. If you presently suffer from kidney disease, a high protein intake will only make matters worse. Although research shows that consuming more than the recommended daily amount of protein will damage your kidneys, many bodybuilders still want to load up on proteins in order to build muscle mass. Your protein intake should be no more than 30% of your calorie intake each day. Here are some interesting facts concerning the relationship between protein intake and kidney disease. Ketones and kidney problems. If your diet contains more than the recommended amount of protein, it can cause ketones, harmful protein waste products, to clog kidney nephrons, filtering units. If you are already experiencing kidney problems, the situation becomes worse. Continued ketone waste buildup in the bloodstream will cause the kidneys to deteriorate and will lead to chronic kidney problems if you don't reverse your kidney disease. Reduce protein intake to slow down the degeneration of the kidney. Some studies have shown that renal failure can be slowed down by controlling the amount of protein intake. Studies conducted with patients experiencing kidney failure problems show that a high-protein diet increased the kidney problems, while those that decreased their protein intake experienced some relief. Also, when the kidneys try to get rid of the protein waste in the body may lose large amounts of water. This may cause dehydration problems. Prolonging renal function. In order for you to keep your kidneys working properly, you will need to control your protein intake and your blood pressure. For kidney patients with diabetic problems, you have to pay special attention to controlling the amount of sugar in your blood. If you have high blood pressure or sugar problems, you should be very diligent in watching your protein intake. Diseased kidneys can only handle a limited amount of protein. no more than 20 to 50 grams a day. Quality proteins for patients with kidney problems. Your protein source should include chicken, fish, eggs, and soy products. If at all possible, purchase range-fed chickens and organic products to avoid the chemicals and toxins found in commercial products. Avoid most all canned goods. Rather, choose fresh or frozen. Do not use protein products that contain high amounts of phosphorus, such as dried beans, cheese, yogurt, and most nuts. Adopt healthy eating habits, especially if you have kidney problems. Always control your protein intake, but be sure to consume enough calories to maintain your body weight and prevent muscle loss. Many kidney problems can be controlled or often reversed if they are caught in time. Consult with a naturopath or a nutritionist that will recommend natural ways to reverse kidney disease and help you with a good dietary and exercise plan. Negative effects of alcohol on the kidney. Kidneys are body organs that most of us take for granted. They're hidden, do their job, and generally require no intervention or attention until they fail. By then it may be too late, hastening death or, at the very least, making life intolerable. In fact, however, we could be doing major damage right now to these vital organs without knowing it. Every time we consume alcohol, we're putting our kidneys, as well as other parts of the body, in jeopardy. Here's what's so bad about chronic drinking and the long-term damage alcohol can do to the kidneys. How kidneys function. First, though, it's important to understand the role and function of the kidneys. How important are they to the body? What exactly do they do? According to the National Kidney Foundation, the kidneys have 6 vital functions in the human body. Kidneys filter the blood to remove toxins and wastes. Vitamin D, important for healthy bone maintenance, is activated by the kidneys. Regulating the volume and concentration of the body's fluids is a function handled by the kidneys. Keeping blood pressure in balance and under control is accomplished by the kidneys' release of a hormone. Kidneys also release a hormone that directs the body's production of red blood cells. Blood minerals, potassium, sodium, and phosphorus, are maintained in balance by the kidneys. Clearly, healthy kidneys are essential to overall well-being. How alcohol affects the kidneys. One of the toxins that kidneys filter from the blood is alcohol. All the lies out there by people making excuses and trying to justify their alcohol intake have been debunked. No, a little alcohol is not good for the body. In fact, many studies have pointed out that an alcohol-less life is the better way to go. Heavy drinking, binge drinking, and chronic drinking is bound to wreak havoc on the kidneys. Alcohol counteracts the kidneys' toxin filtering capacity, thus setting the stage for further damage and increased risk of medical complications. Besides the kidneys' filtering of toxins function, they also help maintain the right amount of water in the body. Alcohol has a drying effect, which can seriously impair the kidney's ability to keep bodily fluids in balance. Dehydration from alcohol affects not only the kidneys, but hampers the functioning of other organs and cells. Another negative effect of alcohol consumption on the kidneys is what it does to blood pressure. Drinking alcohol to excess can lead to an increase in blood pressure. Alcoholics and heavy drinkers are more likely to have high blood pressure than moderate drinkers or those who abstain from drinking alcohol. Over time, this can lead to chronic high blood pressure. One of the most common causes of kidney disease is high blood pressure. There's also the risk of liver disease from chronic drinking. To filter blood appropriately, the kidneys need blood flow to them maintained at a certain level. Among alcoholics and others with liver disease, the fine balance of blood flow and blood filtering by the kidneys is thrown off kilter. A key point to remember is that those who have both liver disease, alcoholic fatty liver disease, alcoholic hepatitis, and alcoholic cirrhosis, and impaired or associated kidney disease in the United States are alcohol dependent. Chronic kidney disease. While there are other causes of chronic kidney disease, diabetes, infections, inflammation, other diseases, independent of heavy drinking, there's no denying the fact that the damage to kidneys from excessive and chronic alcohol consumption can. Besides the known causes of chronic kidney disease, risk factors for developing it include smoking, a family history of kidney disease, abnormal kidney structure, obesity, high blood pressure, heart and/or cardiovascular disease, older age, and being African American, Asian American, or Native American. Once chronic kidney disease develops, it affects nearly every part of the body. Potential complications from chronic kidney disease include anemia, bone weakness and fracture, central nervous system damage, which can lead to difficulties breathing, changes in personality, and seizures, heart and cardiovascular disease, end-stage kidney disease requiring either kidney dialysis or transplant, immune response decrease, increasing vulnerability to infection, retention of fluid, which can lead to swelling in the feet, legs, and arms, high blood pressure, or fluid buildup in the lungs, called pulmonary edema, hyperkalemia, a sudden rise in blood potassium levels, which can damage the heart's ability to function and can be life-threatening, pericarditis, an inflammation of the membrane surrounding the heart, pregnancy complications, and sexual problems, including decreased sex drive, reduced fertility, or erectile dysfunction. How to protect the kidneys from alcohol's effects. The simple solution for protecting kidneys from the damaging effect of long-term alcoholic consumption is to stop drinking. This may not be practical for some moderate drinkers, although heavy drinkers and those who have been diagnosed as alcoholic or alcohol dependent may be more motivated to change their lifestyle, get professional treatment, and learn to live alcohol-free. Anyone who wants to be as healthy as possible can help prevent the damage alcohol may do over the long term by cutting back on the amount and frequency of alcohol they consume, and what would even be best is to cut it out altogether. Simply eating a meal before heavy drinking will not exert a protective effect. Over time, excessive alcohol consumption will exact a toll on the body. Avoiding the combination of drugs and alcohol, including prescription medications, is another way to provide some protection for the kidneys due to the 1-2 punch of these powerful substances. Those with existing kidney problems, diabetics, and other risk factors should be wary of drinking alcohol. Always check with the doctor before deciding that drinking is an acceptable risk. It may not be, particularly for your kid. Foods to avoid when on a renal diet. The first step in healthy eating is having the right foods stocked in your kitchen. Because many foods are hidden sources of sugar and sodium, it is important to know what's really in your refrigerator. The two leading causes of kidney disease are diabetes and high blood pressure, but when these conditions are controlled, kidney disease can often be prevented or slowed down. Making healthy food choices and controlling sugar, fat, sodium, and salt intake can make a big difference in managing the risk factors for kidney disease and protecting the kidneys. Keep these foods out of your daily diet to keep your kidneys healthy. Number 1. Soda. Steer clear. Soda provides no nutritional benefit and is packed with sugars, either natural or chemically manufactured. This equates to extra calories in your diet and can ultimately result in unwanted weight gain. A typical 12-ounce cola has 152 calories, and in some places, this is considered a small serving of soda. There are stores in the United States that sell soda in 50-ounce servings. Studies have linked sodas to conditions like osteoporosis, kidney disease, metabolic syndrome, and dental problems. Diet sodas may be lower in calories but still provide no nutritional value and often contain additives, including artificial sweeteners. Skip the soda and reach for water instead. If you don't like the taste of plain water, add a slice or two of fresh fruit to add flavor. Number 2. Processed deli meats. Scrap cold cuts like bologna and ham from your diet. Processed meats can be significant sources of sodium and also nitrates, which have been linked to cancer. Choose leaner meats like fresh roasted turkey or chicken and always opt for the low-sodium, low-nitrate meats. Number 3. Butter. Skimp on the spread. Butter is made from animal fat and contains cholesterol, calories, and high levels of saturated fat. Margarine is made from vegetable oil and is higher in the good fats, but may not be a better choice because it often contains trans fats. When possible, use canola or olive oil instead. If you opt for a spread, go for one that is lower in calories and saturated fat and contains no trans fats. Number 4. Mayonnaise. 1 tablespoon of mayonnaise contains a whopping 103 calories. Not only is it high in calories, it also contains high levels of saturated fat. Lower calorie and fat-free mayonnaises are available on the market, but they are often higher in sodium and sugar and may contain other additives. A healthier swap involves replacing your mayonnaise with plain, non-fat Greek yogurt, which is high in protein and mixes nicely to bind salads. Number 5. Frozen meals. Studies have shown that processed foods may contribute to the development of type 2 diabetes, and frozen or pre-made meals like frozen pizza and microwavable dinners are often heavily processed. Heavy processing can mean hidden sugar, sodium, and fat. However, not all frozen foods are created equal. It is always a good idea to prepare fresh and whole foods when you can, but sometimes convenience is key, so if you opt for frozen meals, read the labels carefully. Look for those that are low sodium or no sodium added, and avoid frozen meals with added sugar, fillers, or any other additives. Balance out the meal by adding in fresh fruit and vegetables if they are not included in the frozen meal. When your kidneys are not functioning normally, your blood might become too acidic, or your potassium levels might rise to abnormal levels, which can be influenced by your diet. Symptoms of these chemical imbalances include nausea, vomiting, fatigue, numbness, tingling, skipped heartbeats, dizziness with standing, and weakness. Contact your doctor right away if you experience any of these symptoms. Renal Diet Meal Recipes. Apple Brie Pizza. Pizza crust. Measure flour and yeast into food processor. This can also be done by hand. With lid in place and machine running, pour hot water and cooking oil through food chute. Process for about 50 seconds until a ball is formed. Remove and wrap in plastic wrap. Let rest for 10 minutes. Divide dough into 2 equal portions. Sprinkle 1 teaspoon cornmeal on working surface. Roll 1 portion of dough over cornmeal to 10-inch diameter. Repeat with second portion of dough. Place on greasing baking sheet. Poke holes all over dough with fork. Bake on bottom rack at 450 degrees Fahrenheit, 230 degrees Celsius, oven for about 10 minutes. You can bake these one at a time. Cool. Topping. Mash brie cheese, sour cream, dill weed, and apple juice with fork on large plate. No need to mash until smooth, but rather to coarsely mix. Divide between crusts. Arrange apple slices in single layer over each. Sprinkle with Parmesan cheese. Bake in center of 450 degree Fahrenheit oven for about 5 minutes, until crust is crisp and surface is beginning to turn golden. Cut each pizza into 12 wedges for a total of 24 wedges. 2 pizza wedges equal 1 bread/starch serving. Pizza crust. 1 1/4 cup all-purpose flour, 1 teaspoon instant yeast, ½ cup hot water, 4 teaspoons cooking oil, 2 teaspoons cornmeal. Topping. 7-ounce brie cheese with rind, softened, 2 tablespoons sour cream, 1/4 teaspoon dill weed, 1 teaspoon apple juice, 1 to 2 medium red apples with peel cut into paper-thin wedges, 2 teaspoons grated Parmesan cheese. Baked garlic. Baking garlic cloves results in a mild, sweet, nutty flavor and a buttery consistency. Ingredients: 4 whole bulbs or heads of garlic, 1 tablespoon olive oil, 1 teaspoon dried oregano or rosemary, a small covered baking dish, toasted bread such as French bread or baguette. Instructions: preheat oven to 375 degrees Fahrenheit. Cut tops off garlic bulbs to expose cloves. Cut off about 1/2 inch. Brush with oil and sprinkle with herbs. Bake covered for 1 hour, basting occasionally. Squeeze garlic out of its skin and enjoy. Spread on your favorite toasted bread or use as a base for wonderful sauces. Broccoli dip in French bread. Ingredients: 10-ounce package frozen broccoli, chopped, 1 cup sour cream, ½ cup low-calorie mayonnaise, 2 tablespoons green onion, chopped, including tops, 1 tablespoon dried parsley, ½ a teaspoon dill weed, 1 teaspoon garlic powder. Instructions: thaw broccoli. Squeeze out excess moisture with paper towel. Finely chop broccoli. In small bowl, combine sour cream and mayonnaise. Blend well. Stir in broccoli and remaining ingredients. Refrigerate at least 2 hours. Heat oven to 350 degrees Fahrenheit. Slice off top crust of French bread and hollow out inside of loaf. Cut removed bread into chunks and place on ungreased cookie sheet. Bake at 350 degrees Fahrenheit for 8 to 10 minutes or until lightly toasted. Spoon dip into hollowed out bread loaf. Serve with toasted bread chunks or salt-free crackers. Deviled eggs. Ingredients: dash of paprika, pepper to taste, 2 tablespoons 30 milliliters mayonnaise, half teaspoon 2.5 milliliters dry mustard, half teaspoon 2.5 milliliters vinegar, 1 tablespoon 15 milliliters onion, finely chopped, 4 hard-boiled eggs. Instructions: cut eggs in half lengthwise and remove yolk. Mash yolks with a fork and mix with remaining ingredients, except paprika. Refill eggs, heaping slightly. Sprinkle with paprika. Mexican nibbles. Ingredients: 1 egg white, room temperature, 2.5 teaspoons chili powder, half teaspoon cumin, quarter teaspoon garlic powder, 3 cups cereal. Instructions: beat egg white until foamy. Combine next 3 ingredients in bowl, stir well. Fold into egg white. Add cereal, stir gently to coat. Spread mixture on lightly greased cookie sheet. Bake at 325 degrees Fahrenheit for 15 minutes, stirring every 5 minutes. Cool on sheet. Store tightly covered. Nuts and bolts. Ingredients: 4 cups Cheerios, 4 cups Shreddies, 2 cups white bread cut in cubes, quarter cup margarine melted, half cup oil, half teaspoon garlic powder, 1 teaspoon onion powder, quarter teaspoon black pepper. Instructions: 1. Place white bread on a cutting board, cut into cubes. 2. In a large bowl, mix together bread cubes and cereals. 3. In a small bowl, melt margarine. Pour margarine over cereal mixture. 4. Add oil and spices to cereal mixture. Stir well. 5. Spread mixture onto 2 cookie sheets. Bake in a 250-degree Fahrenheit oven for 1 hour. 6. Cool and store in a covered container. Say cheese! Cheese contains phosphorus. Some cheeses have more phosphorus than others. People on renal diets need to limit cheese. Here are some cheeses that are lower in phosphorus. Remember, you still need to limit these. Brie, 1 ounce. Cottage cheese, quarter cup. Cream cheese, 2 ounce. Soft goat cheese, 1 ounce. Here is a quick appetizer made with cheese. Cream cheese, any size. Green pepper or jalapeno jelly. Spoon jelly over slightly softened cream cheese. Serve with unsalted crackers. Strawberry lemonade slush. Ingredients: 1/3 cup lemonade base or sugar-free lemon base, half cup strawberries, fresh or unsweetened frozen, 1 tablespoon sugar or Splenda granular no-calorie sweetener, half cup ice cubes. Instructions: 1. In a blender, combine strawberries, lemonade base, and 1 tablespoon sugar or Splenda. Blend until smooth. 2. With blender running, add half cup ice cubes, 1 at a time, through opening and lid until beverage is slushy. 3. Sip slowly and enjoy. Tortillas with peach salsa. Ingredients: 4 white flour soft tortilla shells, 10-inch. Half teaspoon cinnamon. 1 tablespoon white sugar. 1 can peach slices, canned in juice, drained and chopped, 14 ounces or 398 milliliters. Half cup applesauce, unsweetened. 1 tablespoon brown sugar. 6 grapes, red or green, chopped. Instructions: 1. Place tortilla on cutting board. Brush with a small amount of water. Sprinkle with cinnamon and sugar. Cut tortilla into 8 wedges. Place wedges on a cookie sheet. Repeat with remaining tortillas. Bake tortilla wedges in a 350-degree Fahrenheit oven for 5 to 7 minutes until crisp. 2. Drain peach slices well and discard juice. Chop peaches into small pieces. Place in bowl. Chop grapes. Add to bowl. Mix in applesauce and brown sugar. 3. Serve tortilla crisps with salsa. Tuna snack spread. Ingredients: 1 can, 6 ounces, low-sodium tuna, rinsed and drained. 1 package, 8-ounce, cream cheese. 2 to 3 teaspoons lemon juice. 1 teaspoon onion powder. 3 to 4 drops hot pepper sauce. 1/4 cup fresh minced parsley. Instructions: in a bowl, combine the first 5 ingredients until well mixed. Shape into a ball. Roll in parsley. Chill. Serve with crackers. Watermelon Summer Cooler. Ingredients: 1 cup crushed ice. 1 cup seedless watermelon cubes. 2 teaspoons lime juice. 1 tablespoon sugar or sugar substitute equal to 1 tablespoon sugar. Instructions: 1. Place all ingredients in a blender and blend for 30 seconds. 2. Pour into 2 small glasses and enjoy. Apple muffins. Ingredients: 1 cup, 250 milliliters apples, peeled and diced. 1/3 cup, 80 milliliters applesauce. 3/4 cup, 190 milliliters milk. 1 1/2 teaspoon, 7.5 milliliters baking powder. 1/3 cup, 80 milliliters white sugar. 1 3/4 cup all-purpose flour. 1/4 teaspoon, 1.25 milliliters ground ginger. 1/2 teaspoon, 2.5 milliliters ground cinnamon. Instructions: 1. Mix together the sugar, cinnamon, and ginger. 2. In a large bowl, mix flour, baking powder, sugar mixture, salt, milk, and applesauce. Do not overbeat, as the muffins will get tunnels from the air pockets. 3. Stir in the diced apples. 4. Spoon the batter into 12 greased muffin cups. 5. Bake at 400 degrees Fahrenheit for 20 to 25 minutes or until tops spring back when touched lightly. 6. Served after muffins have cooled down, approximately 30 minutes. Chicken salad. Ingredients: 2 cups cooked chicken, diced or shredded. 1 large hard-boiled egg, chopped. 2 tablespoons onion, diced. 1/4 cup celery, diced. 1/4 cup low-fat mayonnaise. 1 teaspoon fresh lemon juice. 1/3 teaspoon sugar. Black pepper to taste. Instructions: dice or shred chicken. Chop egg, onion, and celery. Place in a large bowl. Add mayonnaise, lemon juice, sugar, and black pepper. Stir all ingredients together. Cover and chill overnight or at least 2 hours before serving. If desired, serve on bread, roll, or pita bread with green leaf lettuce. Dutch apple pancakes. Ingredients: 2 tablespoons butter or margarine. 3 large Granny Smith apples, peeled and sliced. 6 tablespoons granulated sugar. 1 teaspoon ground cinnamon. 3 eggs. 1/2 cup all-purpose flour. 1/2 cup water. 1 tablespoon sour cream. 1 teaspoon grated lemon zest. Instructions: 1. 1. Melt butter or margarine over a medium-high heat in an oven-proof pan. 2. Add apples, sugar, and cinnamon. Sauté and stir 3 to 5 minutes. Remove from heat. 3. In a bowl, beat eggs until frothy. Add flour, water, sour cream, and zest. 4. Beat until smooth batter forms. 5. Pour over apples and bake in 400 degree Fahrenheit oven until puffed and golden brown, about 25 minutes. 6. Cut into 4 wedges and serve directly from the pan. Optional: drizzle honey or dust with powdered sugar. Egg sandwiches. Ingredients: 6 large eggs, or 8 small or medium eggs. 1/2 cup finely chopped celery. 1/4 cup chopped green pepper, optional. 2 tablespoons finely chopped green onion. 1/3 cup mayonnaise. A dash of pepper or other salt-free seasoning. 12 slices of bread. Instructions: place eggs in enough cold water to cover them completely. Bring to a rolling boil over high heat. Reduce heat to a medium boil and cook for an additional 12 minutes. Place eggs in cold water until eggs are cool to touch. Refrigerate eggs until ready to peel. Peel eggs and mash in a bowl. Add the other ingredients to bowl and mix together. Spread egg mixture onto bread. French toast. Ingredients: 1 cup brown sugar or brown sugar substitute, ½ cup margarine melted, 3 teaspoons cinnamon, 3 apples peeled, cored, and thinly sliced, ½ cup dried cranberries, 1 loaf white bread cut into 1-inch slices, 6 eggs, 1 1/2 cups rice dream, 1 tablespoon vanilla. Instructions: 1. In a 13 by 9-inch dish, combine brown sugar, margarine, and 1 teaspoon cinnamon. Add apples and cranberries. Toss well to coat. 2. Spread apple mixture evenly over bottom of baking dish. Arrange bread slices on top. 3. Mix eggs, rice milk, vanilla, and remaining 2 teaspoons cinnamon until well blended. Pour mixture over bread, soaking bread completely. Cover and refrigerate 4 to 24 hours. 4. Preheat oven to 375 degrees Fahrenheit. 5. Cover baking dish with foil and bake for 40 minutes. Uncover and bake for 5 minutes. 6. Remove dish from oven and let stand for 5 minutes. Serve warm. Lemon poppy seed muffins. Ingredients: 2 cups, 500 milliliters, all-purpose flour. ½ cup, 125 milliliters, white sugar. 1/4 cup, 50 milliliters, poppy seeds. 1 teaspoon, 5 milliliters, baking powder. 1 teaspoon, 5 milliliters, baking soda. 1 egg. 3/4 cup, 175 milliliters, milk. 1/4 cup, 50 milliliters, vegetable oil. 1/4 cup, 50 milliliters, lemon juice. 2 tablespoons, 25 milliliters, lemon rind, grated. Instructions: in a large bowl, combine all-purpose flour, sugar, poppy seeds, baking powder, and baking soda. In a separate bowl, mix egg, milk, oil, lemon juice, and grind. Pour into flour mixture and stir just enough to moisten, being careful not to overmix. Spoon into greased, non-stick muffin tins. Bake in a 375 degree Fahrenheit, 190 degrees Celsius oven for 25 to 30 minutes or until conclusion. The kidneys filter waste from the blood and maintain the right balance of fluid in the body. They also play an important role in regulating blood pressure. In general, people with impaired kidney function are advised to eat a diet that supports healthy blood pressure and good blood sugar control. This means avoiding foods high in salt, sugar, and trans fats. It may also be important to avoid excessive protein consumption and foods high in potassium and phosphorus. Specific dietary restrictions should be discussed with your doctor since individual requirements vary. Reduce sodium intake. Americans consume too much sodium. Salt. Limit red meat. Diets high in protein, especially those with animal protein, may harm the kidneys. Red meat is also high in saturated fat. Avoid soda. Sugar-sweetened drinks, like sodas, are high in calories and contain no nutritious value. Additionally, colas have phosphorus additives which can damage kidneys. Give up processed foods. Potato chips, crackers, cheese spreads, instant potato mix, and deli meats are all examples of processed foods that are high in phosphorus additives and sodium, both of which can have a damaging effect on the kidneys. Reduce sugar intake. Consuming too much sugar can result in diabetes or obesity, both linked to kidney disease. Kidney disease kills more than 90,000 Americans annually, more than breast or prostate cancer. By eating well, quitting smoking, and maintaining a normal weight, people can protect their kidneys and prevent future damage. Thanks again for buying my book. If you have a minute, please leave a review. I take reviews seriously and always look at them. This way, you are helping me provide you better content that you will love in the future. A review doesn't have to be long, just 1 or 2 sentences and a number of stars you find appropriate. Hopefully 5, of course. Also, if I think your review is useful, I will mark it as helpful. This will help you become more known on Amazon as a decent reviewer and will ensure that more authors will contact you with free ebooks in the future. This is how we can help each other. Disclaimer: this information is provided as is. The author, publishers and/or marketers, and narrator of this information disclaim any loss or liability, either directly or indirectly, as a consequence of applying the information presented herein, or in regard to the use and application of said information. No guarantee is given, either expressed or implied, in regard to the merchantability, accuracy, or acceptability of the information. These pages within this ebook have been copyrighted. This has been Renal Diet Plan and Cookbook for Kidney Disease and Health, written by Shelby Anderson, narrated by Mark Booker. Copyright 2018 by Shelby Anderson, production copyright 2018 by Shelby Anderson.